Over the past 9 months, we started a national conversation on the linkage between sugary drinks and obesity. And despite yesterday's temporary setback, I don't think there's any doubt that momentum is moving in our direction. In the weeks and months ahead, we will continue to tackle the obesity epidemic, and more people who care about the damaging effects of obesity will do exactly the same thing. Not because they have to, but because they think it's the right thing to do, and that's why we're here at Lucky's Café in East Midtown. Lucky's has chosen to voluntarily comply with our administration's reform limiting the portion size of sugary drinks. And I want to thank owner Greg Anagnostopoulos. It's the tall guy right back there. Wave your hand.
And my father, too.
And his father's name is Anagnostopoulos as well. And I assume if he has a son, it's Anagnostopoulos. And Hayden now owes me 25 cents because she bet I could not say Anagnostopoulos, and I can. Bloomberg is a little bit easier, but not all the same. Anyways, but I want to thank Greg and his entire team for getting out in front on this critical issue. Lucky's recognizes both what the data shows and what our growing number of supporters have been saying for months. Sugary drink consumption is a key driver of the obesity epidemic in our city and across the United States. In fact, as a study released just yesterday shows, 9 of the top 10 neighborhoods with the highest citywide obesity rates were also the communities where New Yorkers consumed the most sugary drinks. So there really is an irrefutable, strong connection between sugary drink consumption and obesity, and that's why reducing the amount of sugary drinks we consume is the simplest dietary change any of us can make to help lose weight or maintain a healthy weight. We will appeal the judge's decision on the ruling yesterday. We are confident that we will win that, but while the legal case plays out, the conversation we started about the dangers of the portion sizes of sugary drinks has prompted many people like Greg to take action, and we came here to applaud him. Obesity is a national epidemic that is getting worse, and in New York City at least, we're not just going to simply wring our hands about it. The fact is nearly 60% of adult New Yorkers are overweight or obese, and each faces a greater risk of developing a host of diseases and conditions, including type 2 diabetes, cancer, hypertension, heart disease, kidney disease, liver disease, joint problems, and blindness. Of course, obesity doesn't just affect adults. Among New York City kids, nearly 40% are overweight or obese. So 60% of adults and 40% of kids overweight or obese. And each faces a higher risk of developing all the diseases I just mentioned. And tragically, each also faces a greater risk of early death. In fact, obesity is the second leading cause, just after smoking, of preventable death in our city. More than 5,000 New Yorkers die each year because they are overweight or obese. And nationally, that number is more than 100,000 preventable deaths and 70,000 just from diabetes alone. So this is a serious thing. Smoking deaths are coming down. Obesity deaths are skyrocketing. And in addition to the tragic human toll, obesity is also placing a growing burden on public finances. Obesity costs New Yorkers over $4 billion for medical care each year. Nationwide, that number is $150 billion each year. Now, if you care about the taxes you're paying and the cost of your medical care, this is one of the reasons why they are both so high. And if you ever want to bring them down, we're going to have to do things like this. Look at the causes, where we're spending our money, and do something about it if we can. And in this case, you're also helping you, your family, Americans live longer, healthier lives. We realize that we can't simply treat the effects of obesity. We must help people change their lives before they ever need to enter a hospital, and that's what our new reform limiting sugary drink size is all about. It builds on the work we've already done to give New Yorkers more information, like calorie counts in restaurants, so they can make better choices about the food they and their families consume. And it is in line with earlier reforms like our ban on trans fats in restaurants. A study released in 2012 showed that New Yorkers, on average, consume nearly 2.5 fewer grams of trans fats per meal after we implemented the ban. So people that think these things don't matter, They do matter. They can get done. They lead to changes in what people eat. And when they lead to changes in what people eat, they live longer. Life expectancy in New York City is better than 2 years greater than the national average, and this is one of the reasons, as is diminished smoking, as is lower crime, as is fewer traffic deaths and fewer fire deaths, and faster ambulance response times. Now, the study went on to say that not only were restaurants serving healthier foods, consumers were also making healthier choices. When we implemented calorie counts in our reform to eliminate trans fats in restaurants, I know there were more than a few skeptics, but today both reforms are recognized as national models. We are confident that yesterday's court decision enjoining our latest health reform will be reversed on appeal, but in the meantime, I wanted to recognize and thank restaurant owners like Greg who are taking a stand on the issue. This is something that each of us can do something about. We can do it for our families and encourage them to eat healthier. We can do it for our friends, talk to them. And if we sell food and sell drinks, we can do the same thing by being responsible and trying to help our customers live longer. In the end, our customers that live longer are going to be happier customers, and they're certainly going to be with us for a lot longer. With that, let me introduce our Health Commissioner, Tom Farley, who really has been instrumental in this and in many of the other battles to make New Yorkers healthier and live longer. Tom?
Thank you. Let me just say, in the last few decades, there's been what amounts to an arms race in portion sizes and food served in restaurants around the country. And the reason is that it costs about the same amount for a restaurant to give you a large portion as a small portion, but they can charge more for a large portion. So the profits are greater to have a larger portion. Portion sizes have increased for all sorts of food items, but they've increased to a greater degree for sugary drinks than anything else. The net result of all of that is that we have all been supersized. And we're paying the price for that in our own health, we're paying the price for that in our children's health, we're paying for it in our life expectancy, and we're paying for it in our wallets. So somewhere along the line, this has to stop. The Board of Health passed a rule that we thought was a very reasonable rule to put a cap on the sugary drinks, which are the single largest contributor to the obesity epidemic. And the judge has currently says that that rule is not in the authority of the Board of Health. We obviously disagree. If you follow the judge's logic, the Board of Health would not have had the ability to prohibit trans fats in restaurants, and so we'd all still be eating trans fats. We wouldn't be having calorie labeling. We wouldn't have the letter grades in the front of the restaurant.
Lead paint.
And we would still have lead in paint, and our children would still be getting brain damage from lead in paint. So we strongly disagree. This is under appeal. But in the meantime, we're asking all restaurateurs to do the responsible thing and voluntarily serve portion sizes that are appropriate to humans, as Lucky's is doing today. So I want to thank Greg Anagnostopoulos, and that's a tough one. It's easy for the mayor to say, it's tough for me to say, for doing the responsible thing. I plan on coming here to have lunch, and I want everybody to recognize the restaurants that are doing the responsible thing and serving appropriate-sized portions. Thank you very much.
Anagnostopoulos, for those of you that want to know. I'm just doing it so Bill de Blasio doesn't have to try it. Our public advocate, Bill de Blasio. I have to adjust the microphone for him, though.
Thank you. Thank you. I'll just say Greg. Thank you, Greg. You know, it's not a secret that I have not been shy when I disagree with the mayor. But I shouldn't be shy when I agree with him. And the mayor is absolutely right on this. And it's important for people to stand with him. When we got together at Montefiore Hospital some months ago to initially unveil this idea, I said I wanted to speak as a public servant and as a parent as well. I want to do that again here. Parents know we are losing the war against obesity. And what do they say is the definition of insanity, doing the same thing over and over and expecting a different result? So let's look at the reality. Our children are exposed to all manner and sort of unhealthy products. And that proliferation that Dr. Farley talked about is something we have to confront. It has been taking us in the wrong direction. When I became convinced, it was from a conversation with Dr. Farley, and Tom, remind me, what was the size of a soda bottle? Back
6.5 ounces.
6.5 ounces.
6.5 ounces. When we were all growing up, 6.5 ounces. Now the largest available drink is 64 ounces over the counter at a fast food establishment. 10 times increase. in just a few decades. It's simply too dangerous. Now, the mayor and the commissioner said something I actually think modestly, and I want to say it more forcefully. They have started a national discussion that is going to change people's habits for the better. You know, one of the commentators said recently, well, it would be easier if people understood the dangers of sugary drinks the way they understand smoking. And I say that's the very reason why this is so important, because it's putting this issue front and center, particularly for parents. And it's making them bolder in saying to their kids that this is going to endanger their health. So I hope the city wins this appeal for the good of our children. It's necessary. We have to appreciate, I want to praise the mayor and appreciate what he has done on public health, because it's exemplary. The smoking ban, which I was honored to be one of the early sponsors of, trans fats, calorie counts. Anyone who's experienced calorie counts knows they are painfully eye-opening. It's a lot of wonderful foods I don't eat anymore, Mr. Mayor, and I have to say thank you, I guess. But they have helped us all be healthier. And this will also help us be healthier, and we need it. My final point. I understand why some people are frustrated on this issue. I understand that people have very strong feelings about what government should or should not do. But I'm appealing to every New Yorker to see this through the eyes of parents, to understand that this is a crisis that must be addressed, that the mayor is doing that, to understand as taxpayers as well, if we don't change these habits, we will continue to pay for it over and over again because of so many unhealthy people who will need the public's help. And it doesn't have to be that way. Thank you.
Bill, thank you, and you were there for us all the time. Another one that has been is the Manhattan Borough President, Scott Stringer. He really has made healthy eating a priority on his agenda. Would you like to? And then, Jim, you want to come up here afterwards?
Well, first of all, I want to... Hello, Jim. Welcome to Manhattan. Thought I'd do a plug.
That's right.
First of all, I'm glad to be back here with the mayor to reiterate my support for this very, very critical initiative. After all, what are we really talking about here today? We're not banning anything. All we're simply saying to our fellow New Yorkers is slow down, think about what you're putting in your body, what you're drinking, and if you really want more soda, you have an opportunity to just get up, stretch a little bit, and go to the counter and get another. That's all we're talking about. But what we're really thinking about is how to make our city much more healthy. 50% of people or more, adults, are obese or overweight, and 30% of our kids are obese or overweight. And that, to me, rings very true when you think about the fact that as a parent of a 15-month-old who someday will be allowed to get out of the house and do what he wants, the reality is I can't control everything he does, nor I'm going to try. But I want to give him more options. I want to make it a little tougher for him to ingest products that will limit his life and his possibilities. This is a long-term plan that the mayor is talking about. This is not just about supersized nation. It's about supersized nation right here in this city. Our kids who come from our poorest neighborhoods are the ones who are suffering from obesity, and it's time for all of us to wake up to a reality that says we have an obligation to stand up and do something, and to ignore this is basically giving in to the soda cartel that couldn't even wait to talk about healthy initiatives, couldn't even wait to have a longer-term discussion with health professionals and school professionals. What did they do? They went right to court because they know that change is coming in this country and in this city. And I want to reiterate what Bill de Blasio said. We were all there for the smoking ban. And, you know, a lot of people ridiculed you, a lot of people mocked you, a lot of people said this city was going in the wrong direction, you can't ban smoking. Well, we did. And there's a whole lot of folks who are happy that their fathers and mothers are living longer. Doctors are pleased that you go into it for a checkup and 5 things they don't even worry about anymore. And that is happening right here in the city because the mayor and the city administration came up with a policy that said we can do better in terms of health for our children and for adults. So I'm just proud to be here with you. The good news is we have lower courts, but we also have higher courts. So we're going to get to a place where I believe we will institute this program, and you get a lot of credit for this, Mr. Mayor. We'll be back with you again. Thank you very much.
You know, you talk about that. If you take a look, virtually all of South America has now gone smoke-free. All of Western Europe has now gone smoke-free. In Asia, countries are starting to go smoke-free. And that's what scares some of the manufacturers so much. As The Economist said, if it happens here, it will happen everywhere. And if it stopped here, it's going to be a very big problem around this world for people. An awful lot of people are dying. This is not a joke. I know it makes good theater, but the bottom line is 70,000 deaths every year in America from diabetes, 100,000 from all the effects of obesity, 5,000 in New York City alone. Pretty soon next year, we'll probably have more deaths from obesity than from smoking. Another one that's been with us all along is Councilman Jim Gennaro. Jim, you want to say something?
Thank you. Thank you much. Thank you very much, Mr. Mayor, for having me here today. Thank you for this initiative. I'm happy to be here. Sorry that I was a little late. I think the best way to characterize what the mayor is trying to do here is he's trying to denormalize the practice of consuming huge amounts of sugar. This should be denormalized. No one thought many years ago that we'd be able to denormalize smoking. It has happened, and look at the results, look at the record, look at how people are more healthy. I think it's critically important now that we take this step and denormalize the consumption of gratuitous amounts of soda. I mean, back in the iconic days of like the pale green Coke bottle that we all remember. That was 6.5 ounces. So that was the definition of like a sugar rush back then. So you had 6.5 ounces of soda. That was your Coca-Cola. And now it's not 6.5 ounces. It's 64 or, whatever it is. And so we have to take this step. And I want to stand with all the people that have made very good statements on this. But it's critically important that we take this step. And, 20 years from now, they're going to look back at like what we're doing today, and I think there'll be a great positive result, not only in the city, but as it ripples through the health community in this country. And I think the days of the 64-ounce soda, this is the beginning of the end for that. And I thank the mayor for that. I thank the health commissioner, and I'm very proud to stand with the mayor on this very good day. Thank you.
Thank you. Greg Anagnostopoulos is the next one, who's coming straight over here. This is 64 ounce. Just think about that.
Go near these things. A lot of cameras in here.
Your business.
Yeah, business.
Tell them where the restaurant's.
Not good for my stomach, but it's okay. We're on 34th Street and First Avenue in Manhattan, and I just want to thank the mayor for coming today and recognizing that we support what he's doing and his policies. And I just want to say that it's not something that we just did because the trying to pass a law, or we're trying to make more money, or we're trying to we did it because I believe it. That's how I grew up. My parents raised me without soda in the house. We were only allowed to drink soda on the weekends, or not even on the weekends, on like special holidays. And it's just the way I grew up. It's that's how life was, and it still is. And I've actually made an effort to eat healthier and drink healthier, and just have a healthier lifestyle. And because of this, this is not just something that is going to change the world overnight. I think it's going to spark something, a start to something that's going to make life different in this country and in the city, because you see a lot of it everywhere. And I see, being across the street from NYU Hospital, we see a lot of good and a lot of bad. A lot of the bad is stuff from sugar. People with diabetes. You go on Google and you search a little bit, and you can see what how bad sugar really is for you, from inflammation to diabetes to everything. And all you have to be is have a little common sense and know that it's not good for you. I mean, I have a sweet tooth. I have a piece of cake once in a while. I have a soda once in a while. I mean, I know I'm not going to die from it, but my daily routine now is much healthier and much more conscious. My father here too, he helps push customers. You know, we have very good relationships here with our customers. We're not a franchise. We don't have 100 restaurants, and, you know, we're just looking at the bottom line, because it's not about money at the end of the day. This is about making a, you know, change, helping make a change in this country. And I'm just glad that, you know, everybody's here to recognize and realize that we, you know, that's what we're about. And I know even if this doesn't pass, if they appeal and it doesn't pass, this already started the change. The people are already going to start being healthier. You know, that's just what I believe. And I get a really great sense of gratification knowing that people, you know, recognize this, and people that do agree with this should speak out more, because nobody says anything. You know, you only hear everything bad. You know, oh, you can't tell me what to drink. Just you drink whatever you want. You could have six cans. You could have 12 fountain sodas. I don't care. But at the end of the day, if we offer you a 64 ounce and you drink it all, I think that's the worst thing you could do. You know, it's like shoving a cake down your throat, a whole cake. What's good in that? You know, moderation. That's what I believe. Sorry. Moderation.
Greg, thank you. With us today is also NYU nutrition professor Lisa Young, Lorraine Ryan, Senior Vice President of the Greater New York Hospital Association, Borough of Brooklyn Ecumenical Advisory Group Pastor Brian Carter, Andy Ackerman, Executive Director of the Children's Aid Society President and CEO, Dr. Stephen Safyer, President and CEO of Montefiore Medical Center, and Harlem Children's Zone President and CEO Geoffrey Canada. And we're going to hear from the last two of them. First, Dr. Safyer. Stephen?
Greg, that was beautiful. It's from the heart.
No script.
We're here to stand with the mayor. Montefiore has stood with this mayor from the beginning in terms of everything that he has tried to take on in terms of public health. We're huge admirers, and we have followed him at every step or been right out there in the lead in banning trans fats and banning smoking in our facilities. But unfortunately, we have watched the Bronx, where Montefiore is situated, witness one of the worst epidemics we have ever faced. 34 years ago, I went to the Bronx to take care of patients. I was in the early days of HIV/AIDS and tuberculosis. That was a real challenge, but it does not compare to what we're seeing now with obesity. Unfortunately, I need to report to you that the Bronx is the epicenter of obesity in the city, the state, and the country. Unfortunately, 2/3 of the Bronx is clinically obese, and 1/3 of the children are obese. This is a tragedy. Our children are our future. So we stood with the mayor. We have taken all sugar drinks out of every venue at Montefiore, 150 of them. 900,000 people come through there a year, and the 200,000 children that come through there a year cannot get a sweet drink. So we stand with you still. We're optimistic that this will prevail, and we support you in your leadership, Mayor.
Stephen, thank you. Montefiore has always been a leader, and we'd expect nothing less from a great hospital like that. Our other speaker is Geoffrey Canada. Geoffrey?
Yep. Thanks, Mr. Mayor. So there's just a couple of things I want to say. First of all, like Montefiore, the children of Harlem are at the epicenter of this epidemic. This is a disaster. This is not just simply a bunch of words. I have to look at children every day who are suffering from an epidemic that did not exist when I began my career. So that's one issue. Here's the second thing. Children drink as much soda as is in front of them. You give them 6 ounces, they'll drink 6 ounces, they'll be fine. You give them 12 ounces, they'll drink 12 ounces, they'll be fine. If you give a child 64 ounces, they will drink the entire thing thinking it's the regular size portion. Adults have to be responsible. The mayor and the health commissioner talk about what happened with smoking. You know, I grew up in the South Bronx, right here in New York City, and I smoked as a kid because there was a debate that it was not unhealthy for you. And I thought, If it was really bad, someone would say something. When government refuses to acknowledge that sugar in certain sizes is toxic to the body, that you just tell young people it's fine for you to drink that, it's not going to harm you, I think that government is not doing its job. So as much as folk have criticized the mayor and the other elected officials taking a public stance, I think for my kids, they have to have a message that we think this is bad for you, and we're going to say enough is enough. Thank you.
Geoffrey, thank you. I remember as a kid, one of the major beverage companies used to advertise 16 ounces, serves 3. That was their big advertising campaign. And when you talk about smoking, most of the cigarette companies had doctors in their advertisements because people were worried, and these doctors probably killed themselves, but they certainly helped contribute to killing other people by encouraging people to smoke and giving it an imprimatur which it doesn't deserve. I also should point out that in our city, the person that is as much responsible as anybody else for Tom and his predecessor and my interest in public health is Linda Gibbs, our deputy mayor for health services. And she has a new hairdo. Let me just summarize before we take some questions for our Spanish-speaking New Yorkers. Estamos aquí para reconocer el restaurante Lucky's Café por ofrecer bebidas azucaradas en porciones limitadas y por poner la salud de sus clientes primero. La epidemia de la obesidad está llegando a niveles críticos y debemos hacer todo lo posible por educar a nuestros residentes de las enfermedades que puede traer el alto consumo de azúcar. And with that, we'll be happy to take